So, when you are actually in the hospital, you will have a limited capability for work. And if you are in the hospital, when you are in the hospital, and also when you are out of the hospital, you will still have a limited capability for work. And the Department, as long as the Department of Work and Pension agree that you need time to recover. So, if you actually have an infectious disease, you may also have an official notice not to work because of the infection, and the Department of Work and Pension will actually give you a limited capability for work. And the limited capability for work means you are not supposed to look for work, and because you are unable to work, but you can actually always prepare for work, like training and other things like I said previously. Now, if you are actually in a situation of limited capability for work, having come out from the hospital or having an infection or infectious disease, in which case you are not allowed to go into work for the obvious risks, and you are given a limited capability for work, which is actually an award you get in terms of benefit, and also in terms of classification when you are on actually sickness benefit. And you can actually be given, you need to be, the Department of Work and Pension should send you a form, Universal Credit UC50, Universal Credit 50 form. It's a type of form. I've discussed it about. Check what I have discussed. I've repeated these things because they are very detailed and they can be really complicated. And this form would be intended for you to check if you should be getting limited capability for work-related activity. Limited capability for work-related activity means you are actually found to be sicker than when you are actually limited capability for work. And the difference between limited capability for work and limited capability for work-related activity is that you are limited capability for work, but also for work-related activity, which is actually you are not actually required to look for work. You are not required to do anything at all because you are very sick. And if you are found to be very sick, you would still get your sickness benefit, which is actually more than limited capability for work. The sicker you are, the more benefit you get, and in practice, but also in principle. And we'll discuss the other complexities associated with benefit, which I'm not really going to go into now. Watch the other video. If you fancy even more, you can read more about this at the government website. Thank you so much. So, as always, in the process of filling out this form, or actually requesting this form, if the Department of Work and Pension did not send you the form automatically, normally they should, if you are limited capability for work, without assessing for limited capability for work-related activity. The Department of Work and Pension is supposed to send you actually a form. Sometimes they don't. If they forget, then it is necessary that you take responsibility and contact them actually, and phoning Universal Credit Helpline, the number of which are actually on the government website, or you could go to a public website of Citizen Advice or other of the organizations which actually provide advice generally on social policy, like benefit, like debt, education, health, and all that. Thank you so much. Like I said, they are opening hour at the Department of Work and Pension. They open from 8 a.m. I think 8 a.m. between 8 a.m. and actually, let's say 6. Yes, they open between 8 a.m. and 6 p.m. in the evening, and calls are free from mobile phones and also from landlines. So, if you're having actually a cancer treatment, if you're having a cancer treatment or recovering from cancer, you are likely to have a limited capability for work-related activity, and being treated, and also if being treated with their chemotherapy or radiotherapy, like you are also likely to start treatment in the next 6 months. If you are actually recovering from treatment, and under these circumstances, you are more likely to have a limited capability for work-related activity. This meaning you are very sick, and the part of work on person will usually still send you a universal credit 50 form to complete. You will usually need to wait 3 months to get extra money. Now, if you are not very sick, but you are actually being treated for cancer, like you're being treated for with chemotherapy or radiotherapy, or likely to start treatment in the next 6 months, and recovering from treatment, you will need to get evidence from your doctor to get limited capability for work-related activity. Every time I say this using money benefit which you get, actually these are how they are categorized. And leave a comment below if you think these are actually interesting, if you think it is complicated, if you think it is okay, if you have a view, if you know somebody who is sick, who might not be getting help from the government, leave a comment below, so that if you're living in the UK, but if you're living outside the United Kingdom, also leave a comment below and let me know what your thoughts are in terms of how the government actually support people who are actually sick with money, and with different ways. And also leave a comment below if you think the process is actually complex, if you think it is simple, or if you think something else. Leave a comment below, let me know. Thank you so much for subscribing to my YouTube channel, and thank you for sharing, for leaving a comment, and also clicking notification bell, clicking like, and supporting in whatever way you can, sharing with family and friends, and also leaving positive comment, especially a positive comment. However you do, look after yourself, and also look after your family if you live with a family, if you live alone. And I will actually, emphasize about development. I've also emphasized about culture, and all these are form of progress in the component of progress as I've analyzed throughout my video, and actually stop from time to time from talking about something specific to talking about life, talk about society, policy, politics, ideology, economy, and all these things, and also how you can challenge yourself in different ways, how you can focus, how you can be positive. People are actually suffering a lot from depression. They need help in different ways, but that is okay. And life is about challenge, and the more you actually face challenge, the more mature, the more fulfilled. Life is full of mysteries because we do not know what tomorrow may bring, and whatever tomorrow brings, be happy to the best of your abilities. Get help if you can from whatever. Humility is actually important, and if you go to places where people are really suffering, humility sometimes make a difference because we certainly don't know what tomorrow may bring. We cannot neglect our life because things can change within 24 hours. So assistance are really important, especially the one provided by the state. And I will also say it is actually changing very rapidly, but let us actually focus sometimes on what is happening around us, and also plan our life accordingly. And normally, taking actions is really very important, and also assessing what situation. I mean, what is happening. What, if you do something, you stop and actually make a review, take stock, and see what you have actually progress you have made, whether you're actually in education, whether you are actually working, whether you are actually on benefit, and evaluate, look at your life, take a stock of your life, take a time, and every situation is actually an opportunity. And normally we are overwhelmed by situations around the world, with our family, with our friends, and it is so important to support one another. And life is very special. You are a special person as a human being. If you are a young person, if you are a child, if you are an adult, and whatever happens to you, look after yourself. And thanks so much for watching. So thank you so much for watching, for continue watching. Sometimes if you are a sick person, sometimes your sickness is actually terminally ill, which means your terminal illness means you're going to die shortly, or you might not live more than a year. In this situation, if you are terminally ill, if you have a terminal illness, and actually also your terminal illness is so bad that you might not live more than 1 year, and you will always have a limited capability for work-related activity, which means you will be regarded by the Department of Work and Pension to be extremely sick because you are terminally ill, and also because you don't have long to live. You're probably only going to live you will not live more than a year, which is always a very terrifying report, which one or the other, all of us will go through anyway in our life. But in terms of benefit, you will be given a limited capability for work-related activity in terms of universal credit, in terms of sickness benefit. This is actually means you are seriously ill, and you can now then stop doing work-related requirements and get the extra money straight away. You don't wait for 3 months if you are terminally ill, especially if you are going to live for less than 6 months, less than a year, and you actually stop getting limited capability for work, which is actually when you are on benefit for limited capability for work, where you are considered ordinarily sick. But if you're actually terminally ill, you will be upgraded to being very serious, which is actually will be indicated in terms of benefit to limited capability for work-related activity, moving away from limited capability for work, and you will get your extra money straight away, which is actually good. And you don't need to complete the Universal Credit 50 form, the UC50. You will need to actually send the Department of Work and Pension medical report from a medical doctor or another health professional, and to report. The report will be on SR1, actually sickness report 1. You don't need to pay for it. Actually, you don't need to pay for it. May mean you don't necessarily pay for it. Actually, you don't pay for it, but they say you don't need to pay for it. And if that is the information. So if you're actually very sick, and you can actually ask your doctor or another healthcare professional to email the report to the Department of Work and Pension to save time, because sometimes delay may lead to you losing your benefit. And the complexity of the system is actually glaringly obvious. And if you comment below, if you think under these circumstances this is actually good policy, or if you can speak to your member of parliament if you live in the United Kingdom, the way the benefit policy operate in terms of sickness, in terms of this kind of situation, all this requirement for evidence, and even if somebody is so sick, and if you comment below, let me know. Thank you so much. Continue watching. Normally, if you have a serious illness, there are some treatments and conditions where you will get limited capability for work, or limited capability for work-related activity automatically. If you have a limited capability for work, you might need to wait 3 months to get the extra money. You will still need to put a note on your online account mentioning your diagnosis and explaining how your illness or treatment stops you working or preparing for work. You will have a limited capability for work if you are having weekly dialysis, and if you're also having maybe plasma exchange, if you're having intravenous feeding. Your limited capability for work will continue if you have finished one of these treatments and the Department of Work and Pension agree you need time to recover. The Department of Work and Pension should also send you a UC50 form to check if you should be getting limited capability for work-related activity. Often when you are actually on limited capability for work, there is actually an automated process where the Department of Work and Pension may change you, will send you a form. If they don't, as always, do your best to contact them. So also, if you are if you have a terminal illness and might not live for more than a year, you will always have limited capability for work. You can stop doing work-related requirements and get the extra money straight away. You don't need to complete UC50 form. You will need to send the Department of Work and Pension medical report from your doctor or another health professional. The report will be on form SR1. You don't have to pay for it. Ask the Department of Work and ask your GP or a consultant to email the report to the Department of Work and Pension to save time. If you don't have limited capability for work or limited capability for work related activity, automatically the Department of Work and Pension will send you a form called Universal Credit 50. They will use you will use the form. The Department of Work and Pension will use the form to decide if you should get limited capability for work or limited capability for work related activity. So check how to get ready to complete the Universal Credit form 50 form. If you think you should have got a limited capability for work or limited capability for work related activity automatically without the form or assessment, you can ask for Department of Work and Pension to change the decision. This is all called a mandatory reconsideration. When you're filling out the Universal Credit 50 form, you actually provide evidence and you also prepare your answers and you plan how much time you will need. You try and get evidence to send with the form. Keep a diary. These are some of the checklists. Start filling in the form. So if you get a universal credit and you can't work because you are disabled or have a health condition, you will usually get an extra form to fill in. The form is called the Work Capability Questionnaire or Universal Credit R50. The Department for Work and Pensions, the DWP, use the form to decide whether you have to work or look for work. You don't have to work, but you have to do things to prepare for work, called limited capability for work, and you don't have to work or prepare for work, called limited capability for work related activity. If you are not sure whether you will need to fill in the form, find out who needs to fill in the work capability form. So there are different things you can do. You can actually plan how much time you need, what evidence to send with the form, to keep a diary to help you remember what to include, to plan how much time you will need. The form can take a long time to fill in. Allow time to take breaks if that can help. It's important to give the Department of Work and Pension enough information so they can make the right decision. So in the process of claiming universal credit sickness element, you can actually, by way of necessity, you can plan how much time you will need, how to get evidence to send with the form, to keep a diary to help you remember what to include, and you will always need to plan how much time you will need. The form can take long to fill, to fill in, allow time to take a break. If you can, it's important to give the Department of Work and Pension enough information so they can make the right decision. When you are actually in the process of claiming, you have to send the form back within 4 weeks after you get the form. Otherwise, the Department of Work and Pension might decide you can work. If you decide you can work, it means they are not going ahead with processing the form. If it is more than 4 weeks since you got the form, you should still fill the form in and send the form as soon as you can. The Department of Work and Pension might accept the form if there is a good reason you could not actually send it earlier. If you're late with sending the form, still carry on and fill out the form anyway and send it to the Department of Work and Pension, and they might accept the form even if it is late. You need to have a good reason for not sending the form. You also need to get evidence to send with the form. You can send medical evidence of your condition or disability along with the form. Medical evidence can give the Department of Work and Pension a better idea of how your condition affects your ability to work. You should also send evidence if it supports what you are saying on the form. What you say without evidence may not actually help entirely. You might have it, you may have the evidence already, and for example, print out of the medication you are actually on. May have some letters from specialists, X-ray results, evidence of scans, hospital discharge sheet, an occupational therapist care plan. If you have problems with your mental health, think about any documents or letters you have from someone like your community psychiatric nurse, CNP, or occupational therapist, for example, a care plan, therapist, or a counselor, a social worker. All these are actually professionals who you must have been working with. You can collect information from them. If you don't have a diagnosis, you might necessarily not have a diagnosis. And if you have plain symptoms like stomach problem, tiredness or dizziness, these are actually a state of affair you may be treated for without proper diagnosis. If you don't have any evidence to send, ask your doctor if they can give you a letter explaining your condition and it affects your ability to work. But a point to note from the doctors is that sometimes if you ask for a letter for the Department of Work and Pension or otherwise, you have to pay for it. And leave a comment below if you think that might be a good idea or not, or if that is a policy the government can really can use to help the British people. And if you're not sure what evidence you should actually take, and if you can't afford to pay for now, there may be advice from on the form which says you which say you should not pay, you should not ask or pay for new information. But in practice, sometimes if you're really needing help, you can send new evidence. You can send new evidence if it helps you show the Department of Work and Pension your situation is. Now, under these circumstances, you may be forced to pay for information or any service from the hospital, because these hospitals are private organizations anyway. Though the government says it actually is funding these private organizations to provide public service, sometimes in practice they're trying to save money and they don't pay for something, especially things to do with benefit. And how the government relate benefit with sickness is a mystery, something which I actually I've been talking about. Leave a comment below if you think this is actually the right kind of policy. I think it is not. I think there should be a separation between the benefit situation, which is really complex. You're already very sick, and you are facing a situation. Why part of the reason I'm going through this information to prove that the benefit system needs reform, because with this type of complexity, and a sick person, and also the part of work and person is overstretched. They don't have staff. But I'm not going to stray there. I just want to talk to you about certain specifics before we do analysis, maybe doing the next video. So if you are asked to pay for evidence, and like some doctors might actually charge you for a letter or a new report, and if you can't afford to pay, it's worth asking for copies of recent medical notes or letters from any specialist they are referred to you to. They usually have to give you copies for free, and this you have to go through. And this is actually in practice, in theory. In practice, sometimes you take days or even weeks to get into contact with a medical practitioner, and at the same time you're actually very, very sick. And also, focusing, you're not thinking of benefit, but you're thinking of recovering from work. But you're also, you may have the government say they have money to give to sick people, but if the condition is so complicated for somebody who is sick in the way actually I'm trying to talk about, then you leave a comment below, let me know if this is actually the kind of situation sick people should go through. So going back to this material, you could also send a letter from your partner or a carer, and all these are actually options, because these are all about evidence. If you are not sure what evidence you need, you can get advice if you are not sure whether you need to send a piece of evidence, not sure whether to ask for more evidence to support your case, and having trouble getting the evidence you need. You can talk to an advisor if you are not sure what evidence you need. We have talked about this situation. To talk about evidence, you should send evidence from a medical professional if it explains how your condition or disability affects your day-to-day life or ability to work. For example, if you should send a letter from the consultant summarizing your condition. Now, this is really important, because this actually information, including evidence, and asking for more evidence might help you to actually your claim. If you only have evidence about part of your condition, for example, if the evidence you have doesn't show some of the ways your condition affects you. This is good on paper, but in practice, really, because you see, you're dealing with advisors who are actually overly stretched for resources. You're dealing with hospitals which are actually overly stretched for staff. You're talking about the Department of Work and person who are overly stretched, and you talk about a sick person who may not be even able to walk, may not have actually money for transport, may not have money, and you are actually writing down all these conditions of getting sickness benefit. The purpose for going through this to show to you how tedious, and the money is actually, you talk about maybe money between 100 and maybe 40 or 50 to 400 pounds. It's not much per month. This is what you get paid per month, and for maybe per week in terms of employment support allowance. And you can ask for evidence, and in different ways. You can actually ask somebody who is healthy. Maybe you go to professional, maybe you go to family member, and ask them to help. And you can also explain to medical professional what you want them to confirm about the condition or the symptoms, and you could use the relevant descriptors to work out what to ask for. And this is some of the situation. You could also explain this evidence if will be important to whether the Department of Work and Pension decide to give limited capability for work, or some medical professionals may not actually know evidence can affect the Department of Work and Pension decision. These are actually some of the things which you need professionals to do if you are actually a sick person. But what I'm saying in terms of professional support, and you actually have a situation where everywhere you go within the public sector, there is a major limitation on resources, and let's just look at keeping a diary to make the right decision. The Department of Work and Pension need to know about all the difficulties you have because of your health condition and disability. They want to know about what you can do physically, or and you are also your mental health. So you keep a diary of what happens to you, and to support your communicating evidence to the Department of Work and Pension. So you could keep a diary before you send the form, so it's easier to see what you usually do. Don't delay sending the form. While you keep the diary, you can send more information afterwards if you need to. In the diary, include difficulties you have because of your health condition or disability, medication or treatment you are having for a condition or disability, aids like a walking stick, hearing aid, guide dog, or rails in your home. You don't feel embarrassed about what you do or don't do. It's fine if you can't do something or if you need help, but it's important to tell the Department of Work and Pension they need they need to know what you can manage without anyone else's help. This is actually some of the outlook of the conditions of assessment. How to start filling in the form. When you get the form, it is important to give the Department of Work and Pension all the information they need to make the right decision. Find out what form asks about what to include. Like I said before, the form is called a Universal Credit Form. They are made up of different sections, and you can check when to return the form, check what the Department of Work and Pension need to know, fill in the first section of the form, answer the next section of the form as necessary. If you cannot work because you are disabled or have a health condition, the Department of Work and Pensions, DWP, usually send you a form to check if your universal credit should change. The form is also called Work Capability Questionnaire or Universal Credit 50. The form is your chance to tell the Department of Work and Pension how your conditions or disabilities affect your ability to work. There are questions about what you can do physically and your mental health. Check when to return the form. You will need to send back this form within 4 weeks after you get the form. Otherwise, the Department of Work and Pension might decide you can work. Check the letter which came with the form for the exact date. If you have cancer, you will need to ask your doctor or someone else who is treating you to fill in the last page of the form. They can fill in the form before they can fill in that section of the form before you're finished the rest of the form. That is some of the details. So if it's more than 4 weeks since you got the form, you should still fill it in and send it as soon as you can. The Department of Work and Pension might accept it if there is a good reason you couldn't send it earlier. Check what the Department of Work and Pension needed you to know. They need to know, send it to them. Sure, the Department of Work and Pension will use the form to decide whether you have to work or look for work. You don't have to work, but have to do things to prepare for work called limited capability for work, LWC. They can also decide you don't have to work or prepare for work called limited capability for work related activity. It is important to tell the Department of Work and Pension about all your difficulties you have, so they can make the right decisions. Take time answering each question and have a break when you need to. This will help give the Department of Work and Pension all the information they need. Don't feel embarrassed about your answers. It is fine if you can't do something or if you need help. But it's important to tell the Department of Work and Pension. You need to keep your record. You need to know what you can manage without anyone else's help. There are different sections of the form. You start with the first section of the form. This is to be found on the form on pages 2 to 7. You can also tell the Department of Work and Pension about yourself, your contact details, and any treatment you are getting. If you're returning the form after 4 weeks, explain on page 3 why you couldn't send the form back earlier. The Department of Work and Pension might accept it if there is a good reason. Include as much detail as you can about why you couldn't send the form earlier. For example, if you didn't get the reminder letter, if this happens, check the Department of Work and Pension of your correct address. Also, let them know in case you have been in the hospital or you are too ill. If you had an emergency at home, or the bereavement, if you are out of the country, there is a good reason for late forms which you should provide. If you have good reason may look like not getting the Department of Work and Pension request. For example, if the Department of Work and Pension have the wrong address, or you have had previous problems with their post, so being in hospital or out of the country would be another good reason. You will need to show evidence of this, such as the hospital admission letter, if you are actually in the hospital, or actually if you are not getting enough notice of the request for information, or not getting a reminder under these circumstances. The Department of Work and Pension should give at least 4 weeks to send UC50 form or other information they have asked from you. A reminder at least 3 weeks after their initial request, at least a week to respond after the reminder. Make sure the Department of Work and Pension know about anything that could make you vulnerable. For example, if you have a mental health condition. So the Department of Work and Pension should do extra checks before deciding vulnerable people is fit. A vulnerable person is fit to work. So you can describe your health condition, illnesses, or disabilities, and this you can do on the form on page 6. You can also tell the Department of Work and Pension about your health conditions, illnesses, disabilities. You should tell them how long you have had your health condition or disability. When you are diagnosed, if you have been diagnosed, if you don't have a diagnosis for your condition or disability, you should still include it on the form. Describe your symptoms and how they affect you. It is also a good idea to include information about how your condition or disability affects what you can do each day. Anything you can't do that you could do before. For example, if you used to exercise but now you can't, if your condition has become worse over time, how medications affect you. For example, if you get side effects. If you had to give up work because of your health condition and why that is happening, if you are working or getting ready for work might make your health worse. For example, if traveling to jobs or training would make your mental health condition worse. Working or getting ready for work might mean there is a risk to someone else. For example, if you'd act in a way that's dangerous for other people. Should the partner of work and pension want to know what you can do most days? If your symptoms change or are worse on some days than others, think about what you usually expect to do in a day, what you can do on the bad days, and how often they happen. What you can do on good days, and how often they happen. If you need more space to explain your situation, use page 21 of the form. You can also send more information in a separate file or a piece of paper. Include your name and national insurance number when you send it. In the event where you have a risk to health and uncontrolled diseases in situations pertaining to the same, you actually can get a limited capability for work or limited capability for work related activity without meeting the usual criteria called descriptors. If these situations apply to you as somebody who is claiming to the claimant, and if you should explain, then you should explain the situation on page 6, and you will usually still need to fill in the rest of the form and have a medical assessment. You might get a limited capability for work or limited capability for work-related activity without meeting the descriptors if there would be a risk to yourself or to others if you don't have limited capability for work-related activity or limited capability for work. And if in case you have uncontrolled life-threatening diseases like which actually give risk to life, you get limited capability for work without meeting the descriptors. You will still need to show there would be a risk to yourself and to others, and if they don't have limited capability for work, and you are actually needing to get limited capability for work without meeting the descriptors, and in under this circumstance, you need to show that there would be risk to yourselves and to others, and if you don't have a limited capability for work, and if the risk cannot be removed by prescribed medication or reasonable adjustment, under these circumstances, there might be a risk to yourself or to other people who does the work or work-related requirement would be dangerous for your wealth, including including traveling to and from work, and similar activity. An example would be where there is risk for traveling to jobs, training in their area would make their mental health condition worse while they are out there, and they would act in a way that's dangerous for other people. The Department of Work and Pension will take into account whether the risk is reduced because you have actually had someone who is willing to be able either to go with them when they travel, help them become familiar with their routes, and for example by practicing it with them beforehand, and you will need a limited capability for work if the risk would be from doing work and work related requirements. You will have a work related activity if the risk is only from doing work. The situation involving uncontrolled diseases, uncontrolled diseases is one that either doesn't have a known treatment or has a treatment. You would and which is actually you are not currently taking such a risk, and there needs to be a reason for this. For example, if you are waiting for your doctor to establish the correct medication dose, if your condition changes from day to day, which is actually a changeable situation, you might find it hard to describe a normal day if your symptoms change or are worse on some days than others. The Department of Work and Pension want to know what you can do most days. Think about what you usually expect to do in a day, what you can do on bad days, and how often you have the happen, and what you can do on the good days, and how often they happen. You can use page 6 to describe if you have good or and bad days. For example, if you find it difficult to cope 4 days out of 7, you have 3 good days, all days a week, but on the other days you need to rest. If your patterns are unpredictable, it can be difficult to explain. You can write something like this, and I will explain how many conditions affect me day to day under each question in the rest of the form. And so these are some of the situations you'll find if you use aids. You should write down if you use things like a walking stick or a walking frame. If you can grab rails in the bus, say when you had them fitted, and a wheelchair, hearing aid, a raised toilet seat, visual aids, and equipment to help you get dressed, aids or prosthetic limbs. And if you could reasonably use an aid or other appliances, the Department of Work and Pension assesses your condition as if you are using it, even if you don't. And if your condition is linked to drugs or alcohol, if any of your health conditions or disability are linked to problems with alcohol or drugs, it's important to describe this on page 6. You should include what help or treatment you are getting, and if you are waiting for referral, if you haven't been offered any help. The answer actually are given chronologically, periodically, answering the next section. And the next section of the form is about how the condition of disability affects what you do. And there are questions about what you can do physically and your mental health. If you are getting cancer treatment, you only need to fill in these sections if you are also if you also have other health conditions or disabilities. If you don't have any other conditions or disability, find out how to finish and send the form. If you have other health condition or disability, or you are not getting cancer treatment, you should fill in the next section about how your conditions affect you. And thank you so much for watching this video. Subscribe if you haven't subscribed to this channel, and share with family and friends. Click notification bell and click like, and also leave a comment below. See you in the next video. Thank you. Bye bye. So all I can say is I'm so grateful for everything you've done, and we're coming to an end, to the end of this program. And subscribe to my YouTube channel, and keep watching my videos, leaving a comment below, having a conversation with me. And I'm so delighted. Been dealing with really a complicated topic, and getting better by the day. I'm also trying my best to put just a little bit of entertainment, so that to break the burden. Leave a comment below if you think that is a good idea or not. Because we are content creators, and we provide, we also produce great works of creativity. And I'm so happy that you came